the importance of pelvic floor exercises and how to do them. Hi everyone, welcome to Healthy Living Simplified, where we break down health topics into easy to understand tips. In today's session, let's talk about something incredibly important, but often overlooked: our pelvic floor muscles. These muscles form the foundation of your core, supporting your bladder, bowel, and reproductive organs. Whether you're recovering from childbirth, managing symptoms of incontinence, or simply looking to enhance your core strength, pelvic floor exercises can make a big difference. Let's explore the benefits of these exercises and how to do them effectively. What is the pelvic floor? The pelvic floor is a group of muscles that stretches like a hammock at the base of your pelvis. They support vital organs, maintain bladder and bowel control, and play a role in sexual function. When these muscles are weak, it can lead to problems like urinary leakage, lower back pain, or even pelvic organ prolapse. The good news: regular exercises can strengthen these muscles and prevent such issues. How to identify your pelvic floor muscles? Before we dive into the exercises, it's crucial to identify your pelvic floor muscles. Imagine trying to stop the flow of urine midstream or holding in gas. The muscles you tighten are your pelvic floor muscles. Avoid holding your breath or squeezing your glutes. Focus solely on the pelvic area. Practice this identification step before starting the exercises. Key pelvic floor exercises. 1. Kegel exercise. The most well-known exercise is the Kegel. Here's how to do it. Sit or lie in a comfortable position. Contract your pelvic floor muscles for 5 seconds, then release for 5 seconds. Start with 10 repetitions, 3 times a day. It's subtle and can be done anytime while watching TV or even during your work commute. 2. Bridge pose. This exercise combines core strength with pelvic floor activation. Lie on your back, knees bent, and feet flat on the floor. Lift your hips toward the ceiling, squeezing your pelvic floor muscles at the top. Hold for 5 seconds and slowly lower down. Repeat this 10 to 15 times. 3. Deep breathing with pelvic engagement. Controlled breathing helps activate and relax the pelvic floor muscles. Sit or lie down in a relaxed position. Inhale deeply, allowing your abdomen to expand. As you exhale, gently contract your pelvic floor muscles. Do this for 5 minutes daily to build strength and relaxation. 4. Squats with pelvic activation. This full body exercise strengthens your lower body and pelvic muscles. Lower your hips as if sitting in a chair. Engage your pelvic floor as you return to standing. Perform 10 to 15 reps with proper form. When to practice pelvic floor exercises. The beauty of pelvic floor exercises is their versatility. They can be done anytime, anywhere, whether you're sitting at your desk, relaxing at home, or lying in bed. Just a few minutes a day can lead to noticeable improvements. Benefits of a strong pelvic floor. A strong pelvic floor enhances your quality of life. Improved bladder and bowel control. Better core stability and posture. Enhanced sexual health and satisfaction. Reduced risk of pelvic organ prolapse. Common mistakes to avoid. While these exercises are simple, it's important to avoid common mistakes. Don't overdo it. Like any muscle, the pelvic floor needs rest. Avoid holding your breath. Breathe naturally. Focus solely on the pelvic muscles. Don't clench your thighs or glutes. Pelvic floor exercises are a small but powerful investment in your health. With consistency, you'll notice better control, improved strength, and greater confidence in your daily activities. If you found this helpful, give it a try and share your experience. Don't forget to like, subscribe, and share this with someone who might benefit. Until next time, take care and stay strong. Soothing music fades as text displays. Stay healthy, stay empowered.